Good morning, friends. Happy end of 2025. I hope everyone is looking forward to a winter break. Congress already left, so we are behind, and we should all follow them shortly. We're going to discuss today kind of not only the year we had, but the year ahead, and what is going to be happening at the state legislature and in Congress that will propel our advocacy for the next year. So, if some of you attended our conference and I had to do a keynote speech, and what I did is I went through all of the articles and work, the body of work the disability community had done. And of course, I probably only knew about a third of it, right? And we put together a little presentation to kind of show people how many folks across the state have really been working on lots and lots of different disability issues this year. So, it's kind of overwhelming to think about all the things that all people have done, but it's a snapshot. And this only goes through October. It's hard to believe our conference was in October, and it feels like about 10 years ago. So there has been a tremendous amount of things that people have continued to do even since this presentation. And that just shows you the dedication of this community. And also, now we are starting the cumulative effects of all of those efforts in wins. It may not feel like we've had a lot of wins this year, but we have. And sometimes we're measuring those wins by what didn't happen. For example, the elimination of aging and disability programs within the Department of Health and Human Services. We were really worried about that in March, and there still are going to be impacts, but it didn't happen then. And so we've had more time to kind of get organized. We don't have per capita caps or block grants in Medicaid, and that's a huge win. So as many things as have happened, there have also been a lot of people who have reached out to their friends and neighbors and their lawmakers and done a lot of foundational education on disability issues, as well as building the groundwork for wins to come. This is a great example of that. As many of you know, special education has been one of the items that disability advocates have been worried about at the federal level. There are proposals to eliminate the Department of Education, and already many of the workers at the federal government have been that worked on IDEA implementation or enforcement of that law have been dismissed, or it's been communicated to them that they may not keep their jobs. That has been combined with reductions or changes in the grants that come to states for special education. And in September, one of the Wisconsin was notified that it would not be receiving, it was having existing 5-year grants canceled by the federal government well before they were, the period of time that they were expecting to receive money was going to end. And one of those grants was the deaf-blind grant. Members of the community mobilized, and there was a national New York Times article published about what the loss of that grant would mean. There was a lot of effort. We lost the money. Wisconsin lost the money. But because of those parents, working very hard, they at least got another organization to take notice and provide funding for this year. So that isn't a complete win, but it is a huge win when compared to the cost of doing nothing, which is simply the money is lost, program ends immediately. Now at least there's another year of a school year full of funding that has been supplied by a different source. And this article, which just came out last week, is a follow-up article on those families and this with the impact of losing that grant. Which tells you that all of the work that you've been doing with the media is very important. It isn't only that you get an article the first time, it's that you're creating conditions for a reporter to want to do follow-up pieces on your issues. And we're now starting to see that happen several times. So some of the work that people did maybe in March is starting to pay dividends again now. Another example of that, just this week, fresh. Many of you also have been following the shortfall for special education funding that was announced in November by the Department of Public Instruction. And you might remember that advocates in March worked very, very hard to get an increase in the special education reimbursement rate, 42% up from, I think, 32%, which means for every dollar that school districts have already spent on special education, they were supposed to get 42 cents out of that dollar back. And it was going to go up again the second year of this state biennial budget. But the state set aside a fixed amount of money, and they based how much money they set aside based on old estimates from old costs. So the amount of money they set aside is not enough to keep the promise they made in the budget, which was signed in June. It is now only enough to provide 35 cents instead of 42 cents. And so the Department of Public Instruction made that announcement, and we had many disability advocates and organizations, ours included, and public education advocates. We kind of pitched a public tantrum, to be honest. We threw out press releases saying, hey, this is what has happened and what it means to schools and to students. And within about 5 minutes, we had multiple statewide reporters calling and wanting to do stories on this problem. They did. There was a lot of media coverage of it, and many of you also participated and contacted your local legislators because those articles. It got the attention of a legislator who drafted a bill that would essentially keep the promise that was made in this budget cycle. And that bill went out for co-sponsorship. It was another opportunity for advocates. We did another action alert. So did many education organizations, and lots of legislators heard about this issue again because now there was an opportunity for them to sign on to that idea and said, yes, we'd like to recommit on that to our promise that we made in the state budget. The co-sponsorship was supposed to close Monday, December 15th. But I learned from the office yesterday that they have actually extended that co-sponsorship period to January 9th. They want to give as much time as possible for legislators to decide to sign on to that idea. So what that means is because of all of the advocacy that happened in March, which resulted in the budget increase that happened in June, which resulted in the shortfall that happened in November. Now we have a bill on paper that for the first time in 10 years is saying we should sum sufficiently fund special education, which means we want to fund the reimbursement rate we set, and we want to provide enough money to do it. And we don't want to end up in a position where what we've set aside isn't enough. So we're not going to set aside money. We're just going to say we are reimbursing this amount, and whatever the costs are to get up to that reimbursement level, we will pay. That's a huge victory. And what it means in January is there's another opportunity for advocates because when that bill is introduced, constituents will be able to see who signed on to this idea, who supports this idea of making sure that the amount that is promised is actually delivered. Maybe that bill won't pass. Probably not. Most bills don't pass. Lots of things are introduced. Very few things make it all the way through the process. But it's really important because oftentimes bills and ideas that are introduced and don't pass one session come back another session or in a state budget. And then as folks become more comfortable, and that's how they end up becoming law. It took us 10 years to get to this point, and look how much progress we made in 6 months, because people have been on it, right? So I think that when you think about this year, it isn't only all the little things that have been done, each individual action. It is like water on a rock where all of us have been kind of constantly making contact. And it's been so important, even though not everything we wanted has occurred. It is putting us in the best position possible to make things either less bad or to get some real wins for the disability community in 2026 and beyond. Another example, again, a national media outlet did an article about what is the impact of Affordable Care Act subsidies expiring, and they used a story from Wisconsin. Um, when national reporters do these stories, they're often asking sources in the states for examples of people that they can showcase. So even, this couple that's featured in this story, somehow a reporter had to know to go to them to ask these questions. And being available and raising your hand and sharing these experiences is one way that this reporter can illustrate what is, in fact, the impact of a policy change. And the fact that so many of you have been willing to share your stories or willing to, be contacted by reporters or other organizations. This is all really, really helpful to kind of show not only the rest of the folks in our state, but across the nation, what it means when these policy changes occur. So what should we be watching for? What should we be watching for in January in the state legislature? Here's a list. I'd mentioned the education bill already that's coming. We have talked about the need for additional money to implement the federal requirements that are part of HR 1 on food share. That hasn't occurred. We are learning that perhaps if the legislature approves some amount of money, it might not be the whole amount that the Department of Health Services has requested for food share, and it might be attached to a bill that would make other changes to the program. So these are all things to watch. We've also learned that the same kind of problem that special education has also occurred to the Division of Vocational Rehabilitation Services. They have a shortfall. Again, the amount of money that was reserved by the legislature in the budget was not enough to keep up with the number of people who are requesting DVR services. And so there is now a wait list, and that wait list has implications, but the legislature has a chance to fix it. And there are some other bills that are also impactful to people with disabilities that are either going to pass or they're not. January and February in the state legislature, in the second year of the biennial budget, which is where we are, is a time where there's lots of legislation introduced that maybe legislators know won't pass because they're trying to get their idea out there and maybe bring it back another session. But it's also the last opportunity for all the bills that people have been working on for 2 years to either pass both houses of the legislature and get signed into law or not. And if the answer is not, that they don't pass, you kind of have to start over the next session. So if you're in the state capitol and you see a bunch of people in suits trudging around looking kind of depressed, that's probably all the veteran lobbyists who are seeing 2 years of work either about to move forward or not. A little bit more about the Division of Vocational Rehabilitation Services because we didn't have a number last week when we talked. We sent out an action alert on this, and there is a link to it in the next slide. What has happened is that there are more people who need services than there is money to pay for them. And DVR needs 11 million more state dollars. So to be able to guarantee people won't have to wait through the rest of this biennial budget, which runs through June 30th of 2027. DVR is a matching program, much like Medicaid. So that means the more money the state puts in, it also enables the state to draw down more federal dollars. So that $11 million the state puts in enables us to get more federal money for the same program. We have had a wait list in this state before, but not since 2014. And the estimates DVR are saying is that if you're on the waiting list, you could be there for up to a year for services. Some of the thing I guess I will emphasize here is this is a great illustration of how people with disabilities rely on many systems to keep working well. And when something happens to one of those systems, then it tends to put more pressure on other systems that people with disabilities also rely on. It's kind of like a three-legged stool, right? And specifically with DVR and school transition services and long-term care all kind of work together to help provide employment supports and get people into jobs and hopefully keep them in employed. And so when you have to wait for DVR, that means there's more wait that either school transition services or long-term care have to pick up and take the weight off what DVR is no longer doing, or somebody just doesn't get those services. So there's a relationship here where when DVR is whole, it enables these other two systems to work more efficiently and do more because the resources they have can be better spread out and allocated. We're concerned about the DVR waitlist for a couple reasons. First of all, it is, people with intellectual and developmental disabilities are probably on the top of, who gets served first. It still means that you might have to wait for a year on the waiting list. But people with significant disabilities or less significant disabilities will wait the longest. There are going to be people with disabilities in Badger Care, and those work requirements required by HR 1 are going to impact people in Badger Care. They either will have to prove they are working or prove they are exempt. And a lot of us are thinking about, well, if you have to wait a long time for DVR services, and that is what you need to help get you employed, it could be that you're waiting for DVR at the same time that you're in Badger Care and needing to figure out, needing to either prove that you're exempt from the work requirements or prove that you're working enough. And for a lot of people with disabilities, we know that they're in Badger Care, and some of them are working, and some of them may have a more or harder time proving that they're exempt. So, taking away something that can help get people employed at a time when we're also really paying attention to whether or not people are employed and potentially jeopardizing healthcare coverage if they're not working enough or if they can't prove that they're exempt is a challenge. The other pieces, and I mentioned them already, DVR funding really impacts a lot of school transition programs who rely on DVR services as one of the ways they're trying to connect students to permanent jobs. Some people are going to be eligible for family care and IRIS. Some people are already in family care and IRIS, and there are employment supports that are in those Medicaid funded programs. If there isn't DVR available, or you're on the wait list for DVR, and you might have to get on the wait list before you can, ask for more employment supports within long-term care, that's going to put a challenge on long-term care, because the more people are trying to use Medicaid dollars to make up for things that would have been funded through DVR, that is going to be an increased cost to the home and community-based long-term care system at a time when advocates are very worried that the other cuts from Medicaid, from HR1, will impact exactly those optional HCBS services. So you can kind of see there's no free lunch here, that not fixing or creating a problem where there's a wait list actually just pushes, more pressure onto different systems. And it likely means that nobody gets the service they need in the time frame that is best. And it also means that you're diverting the cost of waiting is being diverted to potentially other programs that may not have the money to be able to provide the services, or are under strain itself. So you can see the action alert on DVR funding, but I think that's a good illustration of, how people's lives are touched by many different programs. Wisconsin Health News, nerd publication, had a piece this week interviewing Wisconsin's Medicaid director, who was being pretty public about needing a lot more detail from the Centers for Medicaid Services about what states can do, or should be doing to implement the new Prove Your Working requirements. On Monday, CMS provided some more information, and there's a link to it here. And I read through it. You can too. It is essentially a repeat of what is in the existing law, HR1, that doesn't provide a lot more clarity for states on how do you translate what the words in the law mean to operational practice. Now, Wisconsin is a state that really wants to automatically exempt as many people as possible from those work requirements, because it means a lot less work for the state and for participants. And CMS is not particularly concerned. They are not interested in necessarily doing the easiest thing that states have advocated for, which is like, can somebody self-attest that they are exempt, and that's good enough? CMS is saying the opposite, and wanting states to use actual claims data, the billing that happens, to decide whether people meet exemptions. And people might have to provide additional documentation, but it isn't being clear about lots of things. Like, how do you use claims data to prove that you're a caregiver, for example, is a question. Or if you are a person with multiple diagnosis, how does all of your claims data, qualify you for being medically frail? Or what if you have a condition that is well managed, so you're not using the healthcare system and there aren't any claims because your condition is well managed? There's lots and lots of questions about how do you document or use existing data to prove that you're exempt, essentially. And CMS is saying, no, we want states to have to find a way to validate that people are in fact exempt. They want a level of information that they can audit and basically assess whether it is true or not. Totally unclear how states will do this. The Medicaid directors as a whole like every state has a system, a Medicaid system. Some states have better systems than others. Some systems need more work than others. Um, but if you want states to move quickly, they need to have flexibility in terms of being able to do what they think is best. Um, and it looks like CMS is not interested in giving states a lot of flexibility. Another set of concerns that our Medicaid director raised in the article, which again shows you how people's lives aren't only tied to one program. He's thinking about how do we align the work requirements for Medicaid with other work requirements in different programs. And when somebody becomes unemployed, you know, and there are requirements for people who are receiving unemployment to be searching for jobs, like could that count as, you know, trying to find work? You know, people who are receiving unemployment are exempt from food share requirements, work requirements, but they're not exempt from Medicaid work requirements. So you can kind of see like there are lots of scenarios where people could easily fall through the cracks and end up not being able to get into Medicaid if they weren't there before, or end up losing Medicaid if states aren't able to problem solve these kind of common situations in a way that is going to preserve people's care. This is a busy slide, but I wanted to kind of lay out for folks what kind of the big inflection points for the next year. So January, the state legislature, it's going to conclude its business. Bills are either going to pass or they're going to die. We're either going to get the additional money we need for DVR and food share, or it's not going to happen. And there will be consequences to that, right? Congress still hasn't passed its federal 2026 budget. There's a January 30th deadline. Are we going to shut the government down again or do another CR? Will there be action on healthcare? These are some things that are going to start happening in the new year. The state legislature is going to be finishing its legislative session, likely in February. Sometimes that creeps to early March. And often in the second year of the legislative cycle, there is a desire by elected officials to end their session early because that gives current elected officials more time to kind of turn to campaigning, you know, to try and run and keep their existing jobs. So lots of legislators are already thinking about the elections that will be held in November of next year, whether they want to run or not. And if they do want to run, wanting to make sure they have as much time as possible to convince potential voters that they should keep their jobs. In May, that's the deadline by which candidates have to submit paperwork. You have to get so many signatures on a petition to be able to have your name on a ballot. So that's the date when officially we will know all of the people who are running for elected office. And there's a lot of positions that are open at the state and the federal level. So voters are going to decide next year who is going to be the next governor for 4 years. Half of the state senate is up for election. I think it's the even numbered districts this time. All of our 99 state assembly seats are up for reelection, and all of our U.S. congressional representatives in Congress are up for reelection. So that's lots of different people who have the ability to make decisions on disability-related policy issues, who are going to be either competing to win that job for the first time or trying to run for re-election and keep the job they already have. In May, we're also going to see the president release his budget proposal that the Congress does an annual appropriations process. So some of what we were talking about last May, we may, that's going to happen in May again. Um, there are also some implementation dates that are going to start coming for the bill that Congress passed this July. So CMS is going to have to produce whatever guidance they are going to produce on work requirements in June. That's when Congress is going to start their federal budget process again. Again, those 12 appropriation bills. In August, that's the state's partisan primary. So all of those elected officials that are running for office, if there's, candidates from multiple candidates within a party, you are voting to determine who will be your decision on your ballot in November. November 3rd is the election day. So all of those positions that people are running for, we find out who will be the decision makers for 2027 after those elections. And it's really important to remember that the governor has a really important role in this state. We will have a new governor. The current governor, Tony Evers, is not running for re-election. So no matter who wins, it will be a new person. And that means that new person has a really, really big job between November and January, because they have to hire an entirely new staff who may or may not know a lot about disability issues. Many of the state agencies have appointed positions, not, leadership positions like, the secretary who you may hear from, and kind of down through the Medicaid director, division of administrators. There are many appointed positions that governors appoint. And those appointed positions really matter to state agencies, because a lot of times they kind of are deciding what the direction policy-wise of those agencies is. And the policy direction is always, following from what the governor's ideas about policy are. So those new people, whomever they are, and they may have, more or less experience in the agencies or the issues that those agencies work on, are going to have a tremendous amount of ability to either continue policies that are in existence, or change them, or maybe even reverse them. That new governor is also going to have to start drafting the next state budget. And that next state budget is going to be really, really important, because that is where Wisconsin is going to start to see decision making about how do we make up for all of these cuts that have happened to federal spending in Medicaid, in SNAP, in special ed, and other grant programs. So it's a lot of work for whomever is elected governor to have to do in a fairly short time. December, the state legislature picks its leaders for next year. And those leaders are important, because those leaders not only determine what the committees are and who's on the committees, but they set the priorities for what their party wants to achieve in the legislature. So you can see, maybe if the legislature is very different, you could see a lot of very different people in decision-making positions, or maybe some of the same. And there will be lots of new legislators who may or may not have a lot of familiarity with disability issues. And then, of course, next January, this time next year, we will be talking about the Medicaid work requirements for Wisconsin going live. So when you think about the next 9 months, incredible opportunities to make sure that candidates understand the importance of disability issues, to really be communicating very clearly with your community members about what changes or policies could mean to people with disabilities and everyone. And also a lot of opportunity to, make sure that when we have new elected leaders, they're thinking about disability and other priorities as they start to have to shape what are they going to do in the next legislative cycle. Going out just a little farther, um, you can kind of see there's a flow, right? There's a cycle here. Next January, those new legislators that are elected in November get seated. The new Congress is seated. In February, that is when the governor has to present his executive budget, the thing he or she needs to put together when after they get elected. And that budget is going to be really important as a starting point of where is that executive going to decide cuts happen first. In March, the budget writing committee for the legislature is going to decide whether they're starting with the governor's draft or doing their own. There's advocacy day in there for survival. And we're going to start the state budget process. And that's going to really be compressed between next March and next June. That's going to be a very intense period where lots of disability programs are going to either be funded the same or funded differently, either cuts or increases. With that vein, Survival Coalition is putting together some pretty intensive community organizing trainings, and these are really designed for people who are with disabilities and family members and folks who are working with people with disabilities. And the purpose of the training is not to tell your story, but how do you do community organizing to strengthen overall collective action for the disability community. And there's 3 sessions. They will be about 3 hours each. They are designed to be interactive, so they will not be recorded. But if there are people in your lives who really want to get a deep dive in how do you do real organizing on disability issues, Survival Coalition is putting that out there, and you can register to commit to all 3 trainings. So 25, we did a lot of work. And 26, there's a lot of work to be done to set us up for all of the things that are going to be really impactful to people with disabilities in 2027, which are actually coming about because of the federal bill that was passed in 2025. And part of our role is to connect the dots between cause and effect, but also our role is to just be consistent and keep the drumbeat going, because that will be the difference between success and change. And perhaps change could go either way. We would like change to be positive. So with all of our collective work, that is going to make the difference as to what those changes are going to be. Congress. Here's our timeline. It's compressed. This week was the last day for people to register for an ACA plan. That was Monday. The House passed a healthcare bill that has 0 chance of passing the Senate, that had no extension to ACA subsidies yesterday. The Senate failed to advance any of the 5 appropriation bills that it had planned to. And that means that they've set themselves up for a pretty intense January. Congress comes back into session January 5th, and they have working days that are between basically 14 working days to get a lot of stuff done. This is their window. Yes, maybe maybe there's some days that are currently marked state, work time that they could decide that they're staying in session. But on their calendar, January 5th through the 16th is their window of time to get now a whole lot of things done. And it happens to be the same set of things that was on their list to do in December. January 30th, that is the deadline they set back when they opened the government in late November as the next deadline where funding would lapse if Congress has not passed their permanent budget or another continuing resolution. So that kind of is the date that is the crisis date. And it looks like they have between January 5th and January 30th to figure a lot of things out. So Congress doesn't agree on a healthcare approach or a plan. And at this point, there isn't anything that can get 60 votes in the Senate, which is the magic number that determines whether or not something can pass. Because if it passes the House and it can't get 60 votes in the Senate, then it doesn't go anywhere. The House healthcare plan, there's a ton of links here for your weekend reading. Here's the big picture takeaways. It doesn't extend the ACA marketplace subsidies. None of the policies in the bill are new ideas. The Congressional Budget Office actually thinks that more people would lose health insurance under these ideas than not. And there are a lot of health experts that are concerned that these policy ideas will end up moving more and more people out of the Affordable Care Act marketplace and really won't do enough to address rising premiums. There is one change in the bill that would kind of offset some of the deductibles and out-of-pocket costs, and you may start to hear members of Congress say, well, see, this is equivalent to an 11% reduction in premiums. Well, maybe these are funds paid to the insurance companies so that they will not have consumers pay as much out-of-pocket costs. And yes, there is a relationship between that and premiums. And yes, it might reduce premiums by 11%, but premiums are going up by 26% and more in many cases. So, I mean, I think for a lot of individual people, it's really too early to tell if those changes would in fact, on balance, put them in a better place than, extending the current subsidies. Just so you know what the ideas are in the bill, a lot of these are all about increasing access to healthcare ideas that are not part of the Affordable Care Act or are not subject to the requirements of the Affordable Care Act to offer a certain set of base coverage and not discriminate against people with pre-existing conditions, no lifetime or annual caps, those core things that the Affordable Care Act changed. A lot of these plans are kind of outside the ACA marketplace, and some of them do not have to conform to the ACA law. So you can read more about what these things are, but I think overall there is more of a direction policy-wise to have alternatives that put more responsibility on individuals to pick and absorb the risk of picking insurance plans that may have less coverage and higher out-of-pocket costs. There are some members of the House, Republican Party, who are very frustrated that the House did not take up an amendment to do anything about extending the Affordable Care Act subsidies. And there's a specific process you may hear about in the news called a discharge petition, where if enough members of Congress, if more than half of them sign on to a specific bill, then that bill can be debated and voted on the floor. It's essentially a way to bypass the leadership's decisions. And the Democrats had a discharge petition for a vote on extending the current subsidies for 3 years. This is the same idea that has been voted down in the Senate multiple times. But it essentially is, let's do what we're doing now for 3 more years. And 4 GOP moderates signed on to that. So it has now enough votes, enough signatures where that will come up in January. There's also a couple other discharge petitions that would do something a little bit different. They would extend the subsidies, but maybe change them or, maybe reduce the amount of time that they're extended. The thing to remember is there's a 7-day legislative waiting period, and by the time there were enough signatures on that discharge position, there were only 6 legislative days left in the year. So there is no doubt that the subsidies that are currently in place will expire on December 31st, even though there is now a pathway that possibly could lead to their extension in January in an unclear way. And remember, there is not agreement in the House about what to do, and there is also not agreement in the Senate about what to do. And anything that is a difference from what we're doing now creates some challenges for states and insurers and, people who are looking for plans, because any changes to the subsidies you'd have to calculate what those changes actually mean in terms of premiums and other things. However, if we were pessimists, we would sit and say, Congress has known exactly when these subsidies expire for a whole year because it's written in black and white in the statute, and they didn't do anything about it. They had the opportunity to extend these subsidies in the tax bill that they passed in July, and they didn't do it. And they've had opportunities to extend them before the government shut down and after the government shut down, and they also didn't do it then. And we had states and insurers and everybody under the sun telling them that it was a good idea. So, their fault. Okay, you're not wrong if you're a pessimist. On the other hand, the optimist in us says, this is actually a sign that all of that work that we have done over the past year has made an impact. It shows that there are members who support extending the subsidies in some way. And it also shows that there are lots of people who have realized that constituents and potential voters are noticing whether or not these subsidies get extended, and they're worried about getting blamed for increasing prices. So the discharge petition maybe goes somewhere or maybe doesn't. At the very least, it's a signal that some members realize they want to be seen trying to do something, and they want to be able to show constituents they voted to support extending subsidies, even if they don't think that ultimately that's going to happen. It also becomes a starting point for January, right? There isn't agreement about what to do about healthcare or what to do, if anything, about subsidies. But it does send up a starting point for, if you're going to do something, starting with current law, what are we negotiating about? Is there a way to get to yes? Congress has said that they think they can fix the subsidy problem after they've already expired. It won't be nearly as good as having done it before the crisis happened. However, there are folks who are thinking about, well, what would you do in January to pass a subsidy, and how would you manage that? And this has happened in the past. We have had subsidies change and kind of retroactively be applied. I think in 2021. Um, anyway, we've been in this situation before. It's not a great situation, but it's doable. And some of the ways that Congress has to kind of address, you know, retroactively saying subsidies are okay is making sure that it applies to everybody who has a plan at a certain date. They could reopen open enrollment so that people have time to adjust their plans if they already have them, or allow new people to sign up, right? Or they could allow people who have plans to adjust, how much their credits are so that they can receive a refund on their taxes. Like, none of this is going to be easy, unless it's a clean extension, unless it's doing exactly what we're doing now, but it is doable. It is also clear that the longer Congress waits to take action, the more people are going to drop their ACA plans. Another critical part in the time frame, there are folks who have had to sign up for plans that start in January 1st. Another thing that health policy watchers are looking at is how many people actually follow through and pay their first premium in January. Because there may be people who have signed up for plans who then decide they can't afford the premium, don't pay it, and end up not, following through on their coverage, right? So the longer Congress waits, the more likely it is that you are going to have people who continue to drop out of the ACA marketplace, and the harder it is for for states and insurers to let to do all of the things necessary to have people successfully sign up for ACA plans. There's the logistics of having to recalculate and reprocess all sorts of people's information, but probably the harder task is reaching out to people who dropped their coverage, who decided before the open enrollment period closed that they couldn't afford any of the ACA plans, or for people who took plans with less coverage, to let them know the numbers have changed and really give them an opportunity to reevaluate their healthcare insurance decisions and make a different decision. So, lots of people have already made decisions. Subsidies, even though when they expire in December 31st, they go back to 2010 levels. So there are some people who will lose a subsidy entirely and some people who will still get one, but depending on income. It is possible to do something after the fact. And that discharge petition is a vehicle if there can be agreement between the Senate and the House on what to put in it, and if it can get 60 votes in the Senate. Some questions that you might ask, if this becomes a topic of discussion in January, is whether your member of Congress has signed the petition or not. And if they haven't, would they? And would they sign the one that says, let's do what we're doing now for 3 years? If they support the subsidies but want to change them, I think there's some other questions you ask about what are you changing? And what would those changes actually mean? And if members aren't willing to extend the subsidies or change the subsidies and extend them, then what are their alternative plans that are going to actually make a difference to individuals who are trying to access healthcare? Another set of questions you can ask is, if you are being told, hey, yeah, I support extending the subsidies in January, that's a great opportunity to ask some more detailed questions about how, in fact, are they going to do that? And, you know, problem solve some of the issues that healthcare experts know are going to happen when people who have already made a choice on a healthcare plan have to know that they can make a different choice. They have to be able to understand what their new options are, and they have to know when they have to make those new decisions. And as a reminder, lots of people have been looking for different options for healthcare because ACA plans have gone up in price. Another question for legislators is, for folks who made a different decision because they knew they couldn't pay their premiums without the subsidies, can they get out of the plans that if they picked a short term or some of these other plans? Can they get an ACA plan now and cancel their other plan that they would not have gotten? Or are they stuck with this? Because there are some people who may have made a decision on a catastrophic or one of these types of plans that can't afford to pay the costs for both that plan and a new ACA plan. And we're not going to go through this a lot, but there's a couple of pretty good articles here about what are some of the options that are kind of outside the ACA, and why they may be a risk, especially if you aren't a person who can guarantee that you're going to be healthy through the entire year. And we've said this before, but healthcare costs continue to rise for everyone. People who have ACA plans see that more directly, but it's also rising for people who have employer and sponsored insurance. The costs are rising for Medicare and Medicaid because healthcare costs are rising. So even if you are not on an ACA plan, your insurance premiums are probably going to go up next year. And if you're in an employer-sponsored plan, the average increase is about 6.5%, but some are saying some people may see almost up to 10% of an increase. And a lot of employers are trying to, keep the premiums low, but may raise your deductible or other co-pays or co-insurance costs as the way to keep the premiums lower, make you responsible for a higher amount of the healthcare coverage you use. So, if we also end up with lots of people losing coverage this year because they were insured with the ACA and they either have less coverage now or no coverage, that ends up trickling down to higher costs because healthcare providers generally raise prices to make up for more individuals who can't afford the care they're receiving. And that can create another cycle where we're going to end up with higher costs again that will be passed on to people who have employer-sponsored insurance. A long way of saying that nobody is getting a good deal this year. Costs are going up, and all of us are going to be paying for some of that. And potentially, the more people can't afford, coverage, the higher those costs will continue to grow. So we've seen these questions before. They're still worth asking Congress because, simply extending the subsidies isn't really getting at the drivers of why healthcare costs keep going up and why individual consumers keep having to be to cover more and more of higher bills that they can't afford. The other big piece of business that Congress had this December was to pass those 2026 federal funding bills. There are 12 appropriation bills. They have passed 3 of them, and they were desperately trying to find a way to pass an additional 5 of those remaining 9 bills this week, including the health and labor and education bill, which includes a lot of disability programs, as well as the housing and transportation bill, which also includes things related to HUD that impact people with disabilities. Um, so for 5 weeks, the Republican senators were negotiating on those bills, and they finally came to an agreement on, you know, on yes, we can take these to the floor. However, then those bills had to go to be reviewed by the Democrats to see if they were okay with what was in them and they could proceed with the floor vote. And this week, the White House decided it was going to stop funding and get rid of a federally funded basically weather center in Colorado for no other reason other than they didn't think it should be funded anymore. Did a lot of climate research. There's also some indications there is an individual who was convicted on state charges that the president has wanted the state of Colorado to release, and they have said, no, this person was convicted on state charges, so no. And this action happened where, again, a federally funded center, there has been a decision by the administration to not do that anymore. And so Colorado's two senators said, we're gonna hold up the entire budget process because, again, here's a pattern where things that had received and been funded by the federal government and were supposed to continue being funded, all of a sudden, without warning, that funding is being stopped and without any input or permission from Congress. Often state senators will take these kinds of actions when they see that something has happened that impacts the entirety of their state. And lots of people work at this particular center. So it is a major thing in Colorado. And what that means is that Congress now has a lot less time to pass these 9 remaining bills, and it's unclear whether there will be other hiccups that senators will identify that need to be changed, or whether actions such as what happened this week to this center in Colorado that's being defunded will end up, being a fight about should the administration's ability to impound or stop funding, or are there going to be any guardrails that senators are going to include to kind of try as a condition of passing a permanent federal budget. And I should be clear, like the Senate is the harder body. Like, we keep focusing on you need to get 60 votes. Because if you can't get 60 votes in the Senate, then it won't pass. So the Senate is starting the process here. And, hopefully in January, we are going to see these bills pass out of the Senate. And that will be a clear sign of, here are the things that will pass muster with the Senate. But that isn't the end of the process. The House has kind of been waiting to see what the Senate will do. So House Republicans haven't agreed on how much all 12 of these bills should be allowed to spend, right? What is the total amount that they want to spend? And the House is kind of waiting to see what ends up in these budget bills before it starts negotiating changes. So even though we're really focused on the Senate and what the Senate does, the reality is, in January, not only does the Senate have to pass these bills, they have to pass muster with the House. And if the House wants changes, those changes have to be agreed upon by the Senate. And that's before they can go to the president to be signed into law. So it's a lot of potential back and forth in a very short amount of time if we are going to see these bills move forward in January. The good news is, at least on these 2 of the 5 appropriation bills, there has been agreement on the budget writing committees that have overseen these particular bills about what should be in them. That's different than whether the whole Senate agrees that with the committee, but we are starting at the best place possible, at least from disability organizations' position to have some clarity about where there is agreement between the House and the Senate and on funding. So the administration, again, another example of how changes kind of keep moving forward over time. In August, we talked about a federal rule proposal that would basically take us back to 1974. Home care workers were classified as companions until about 2013 or 14. And that was important because companions doesn't really represent the work that we all see home care workers do. It's a very different category, and it means that if you're a companion, you don't have to be paid minimum wage and you're not eligible for overtime. That changed, I think, in 2014 to recognize home care workers as domestic workers and make them eligible for not only minimum wage but eligible for overtime. And that rule has been in existence for 12 years. The administration wants to take away that change and go back to what was being done in 1974. In other words, reclassify the same group of workers back down from domestic workers into companions, which means that they lose the right to minimum wage protections and eligibility for overtime. And that means without a universal federal rule that kind of tells all states what they must do, that means that whether or not those workers have a right to minimum wage and overtime is determined by state laws and rules. And in some places, there aren't any protections for these workers under state law. And states also have a variety of approaches for how easy is it for employers to reduce wages. So there was a lot of push to get a universal approach to this policy at the federal level for a very good reason, because otherwise you have 50 different approaches and the same workers who are doing the same kinds of work may have very different rights and protections. At least 25% of home care workers are working in states where there isn't any protection for them. They will lose their right to minimum wage and overtime. For the other 75% of these workers, what their rights are is going to vary quite widely depending on what state they're in. There are some states that have passed wage protections. Wisconsin is not on that list, and we are actually researching right now whether or not, removal of this federal law will enable workers in this state to be paid less than minimum wage and not be paid overtime. In addition, our organization submitted comments. The comment period closed September 2nd. And the rule is anticipated, it hasn't been announced, but it's anticipated it's going to go into effect in January. However, it also seems like the administration is already effectively implementing the change. As of July, the Department of Labor has said, hey, to its staff, don't investigate any home care agencies that have misclassified workers as companions to get out of minimum wage and overtime stuff, and to drop any current cases it has against agencies where there is reason to believe that has happened. So you might ask, who has been asking for this rule change? It does appear that there is a coalition of home care employers that has lobbied for this change extensively. And there has been an increasing amount of consolidation and buying up of small provider agencies by large for-profit for-profit companies and even private equity firms. And there's also a history of home care employers that exploited the old companionship rules, to pay workers less. So there's a home care association that has wanted this rule change, and has said, well, because of these protections, that means that home care costs are higher because we have to pay essentially workers minimum wage and overtime. And if we didn't have to do that, then the costs would be lower. They've been operating under these rules successfully for 12 years. So you can make your own judgment about that. Lots of people in our community recognize the value of these workers and have often been, the people who have been advocating for them to be paid more than they are, and also to have full-on benefits. And, for many family caregivers, the paid workforce is actually supplemental to the volume of care that they are providing for free. Many in our recent Survival Coalition survey, we found that the reliance on family caregivers in terms of the amount of support that they are providing as part of a care plan is really high. And some people are reporting more than an overtime job, like 120 hours a week of care that they are providing. And that is far less than they're receiving from paid caregivers. So, the paid caregiver workforce is actually supplementing what families are already doing, which is why families have been advocates for paid workers. But the reality is, as there have been fewer workers or hours have been cut, there also isn't, when you already have family members contributing as many hours as they currently are, there aren't any more hours or family members that can come in and fill that gap. And we have almost 10 million people in this country right now who are relying on paid workers and family members, oftentimes, to stay out of much higher cost institutional care. Another article, again, this is a follow-up article to, ongoing changes that have been happening really since last March. The Federal Department of Justice, and we've talked about this a couple of times, has cut a number of positions that were really focused on enforcing disability laws. And there are also a number of grants and federal funding sources that went out to state-based disability rights organizations. They're called protection and advocacy organizations. In Wisconsin, you will know that as Disability Rights Wisconsin. And every state has kind of a sister agency like them. Oftentimes it's Disability Rights, insert name of state. So Disability Rights Arkansas, etc. Those are the protection and advocacy organizations. And there's been a lot of funding jeopardy, either taking away money or in fact reassigning or cutting federal positions that their sole role was to enforce to make sure that federal disability laws were enforced. This has been a huge resource for individuals with disabilities because that is the professional expertise that helps them when they are not getting the rights when their civil rights that they are guaranteed under the law are not being followed. And the question is, if you reduce the amount of people and professional expertise and the capacity to help folks whose rights are being violated, what happens when there aren't enough lawyers to make sure those laws are upheld? The article also goes into, the consequences of reducing funding for the state-based protection and advocacy organizations. These are the groups that have a very distinct rule under federal law on watching out for abuse and neglect. And these are the places that have the legal authority to go into facilities where people with disabilities are to check on their conditions, to check on the treatments, to go into institutions or group homes or nursing homes. The article is pretty clear about when you don't have the capacity to have extra eyes and ears in the places that we know people can be at greater risk, then a lot more people could end up, being in those kind of institutional settings without really any recourse or anybody watching out for them. Also this week, there have been some articles kind of tracking the increased use of the R word after not only the president, but other public officials have started using it in routine posts and conversations again. And we in this state have actually had legislation in the last 8 years that has sought to remove the use of the R word in state statute and state administrative rules. Like, there has been consensus across the aisle that there is no need to use that term. And yet now it is being used by the highest leaders in the land. And a lot of advocates are pretty concerned about what that might mean, especially in an environment where we're seeing a lot of clear policy changes in direction on programs that impact people with disabilities. Not only Medicaid cuts and SNAP cuts and cuts to programs that people with disabilities disproportionately rely on, but also all of the changes that are really reducing the capacity to enforce, whether or not states are following IDEA or the Americans with Disabilities Act, or whether people are safe in care settings. And I thought that folks might appreciate, I believe this is the CEO of the ARC who's talking about, I think, pretty clearly why it matters that this term is now being used much more frequently and freely by people in power. In addition, there is an ongoing court case that is about whether or not the administration has to use American Sign Language interpreters. And an article just came out this week that kind of talks about what arguments is the administration using when it's arguing that it shouldn't have to use ASL interpreters. There was a ruling that was trying to provide temporary relief that said, no, you at least have to use interpreters at certain kinds of events. And the administration has appealed that ruling and is arguing that being forced to provide ASL would negatively impact the image the president is trying to present to the public, and that people who use ASL have different ways to get that information, and they can kind of seek it out themselves. And that it's just would be hard for them to find interpreters. Excuse me, if they had to, if they were forced to do so. I think from a disability perspective, again, the idea that individual people should be forced to seek out information in a variety of ways if they want to be informed is kind of opposite to how we have expected our federal government to be communicating to the entire public. Items of national importance have generally been assumed need to be accessible because everybody has to be able to understand what is occurring. So it is notable that, first of all, we see a pattern here where we've seen over the last 12 months, comments about people with autism, comments about people with autism being something that should be prevented, or that, certain kinds of disabilities have less value, use of the R term, the R word, not wanting folks to have accommodations in a few different ways. Like, this is removing the ability to enforce the laws that require accommodations. These are all part of a larger pattern and a larger story that have advocates concerned about how the administration sees people with disabilities and their priorities. Finally, two last slides. The HR 1 allowed states to implement work requirements early if they so chose. Iowa this fall passed a bill that would allow Iowans or what to do it as soon as January 2026. I haven't seen any information on that yet, but Nebraska says it's going to implement its work requirements as of May 1st. And that's interesting because many Medicaid directors are saying, especially without information with CMS to say what they can or are allowed to do, they're very hesitant to move quickly because they don't want the federal agency to tell them that they have to do it differently. They would rather the federal agency say, here's what we want you to do and do that. So the fact that there's a state moving early when many, many other states are saying this is hard, we have a lot of unanswered questions. If we move fast, we will lose people and people will lose their coverage because we haven't thought this through. Nebraska is moving forward, and less than 6 months from now, they are going to be implementing their work requirements, which means they have to start communicating it 3 months before they actually do it. So it looks like about 9% of Nebraska's total Medicaid population will be subject to prove your working requirements. They have more people who are, in that population of people who have to either prove they're working or exempt. And it looks like about 30,000 of them they're estimating have to prove that they're working. This is important because it will allow other states to see how well this goes and to see some of the pitfalls. It will early adopter states give other states some information about what happens when you implement work requirements in advance of maybe when the work requirements are implemented in their state. So it's something to watch. And what some of the things to watch are how many people with disabilities end up not being able to prove they're exempt and dropping off the rolls. How many of those 30,000 people are unable to prove that they are working and enough and drop off the rolls. Those are the kinds of things that when Arkansas and Georgia implemented their work requirements, we have been studied and people started to see fairly quickly that there was a reduction in the number of people who were in Medicaid and the kinds of people that were losing coverage, and why they were losing coverage. And lastly, another article came out this week that is talking about, all of these very large cuts to Medicaid also impact states' efforts to try and contain healthcare spending. There are a number of states, Wisconsin isn't one of them, that have tried to set caps on healthcare spending in order to keep costs lower. But with $1 trillion being cut from Medicaid, a lot of healthcare experts think that hospitals and other providers are going to want to raise prices because they're going to need to make up for those lost Medicaid dollars and, frankly, more uninsured people, either people who have lost their Medicaid coverage or have lost ACA coverage. So it's unclear in the states with caps if hospitals are going to be allowed to raise prices. I think only 2 of those 8 states actually have financial penalties if hospitals raise prices without the state's permission. But most states don't have any of those caps. And that makes it more likely that higher healthcare costs are going to be passed on as, providers raise their prices to make up for people who have lost, insurance coverage and are uninsured. And it probably makes it harder for states who have wanted to do something to put something in place to potentially drive down healthcare prices, it makes it a harder environment for them to take those steps when there's such a increase in uncompensated care. That is the end for this week. We will be back January 9th to do it all again. Sally, were there any questions this time?
There was just one